Elisha speaking here, founder and CEO of FNP Certification Academy. So now we're going to quickly go over some pharmacology. Um, a lot of students struggle with first-line treatments when it comes to FDA-approved medications. So I broke them down here in terms of population. We have pediatrics, we have adolescents, we have geriatric, we have maternity. Okay. So there are more than 40 to 50 DSMs that will be on the exam. So this is not all inclusive. I've only given you 4 diagnoses here: depression, OCD, anxiety, specifically GAD, and then PTSD. Okay, so now when we talk about depression, so for pediatric population that is less than 12 years old, what do you want to give? You want to do fluoxetine. Okay, for all that's for depression. Okay, for pediatric that's less than 12 years old that have OCD, you can also do fluoxetine, but we can also do fluvoxamine. Now, fluvoxamine is not required or is not recommended, mainly because it is not as efficacious for this age group, but it's totally okay to also do fluvoxamine. Okay, if they are less than 12 years old, we rather do fluoxetine we rather pick fluoxetine over fluvoxamine. Now, for pediatric less than 12 years old again, if they have anxiety, we have types of anxiety. Specifically here, we're saying generalized anxiety disorder. You're going to give duloxetine. Okay. Now, for pediatric that is 12 years of age, they have PTSD. There is really no recommendation. Behavioral is more efficacious. So we do psychotherapy like a CBT, which is the first line. Let's not forget the neurotransmitter that is deficient in people with PTSD is what? Serotonin. So it's also okay to go ahead and give serotonin. I hope I'm making sense. Now, there are some clinical notes that I have added here under the 12-year-olds. So when I say MDD, give fluoxetine for kids that are less than 12. Only SSRI is FDA approved for depression in children that are more than 8 years of age. For OCD, I had put a little comment and said FDA approved drugs for OCD more than 7 years is fluoxetine because it is considered to be the safest. All right. But there are some people that are less than 12, but they truly are like an adult, and that in that case, we consider fluvoxamine sometimes. Okay, now what about adolescent? Adolescent, that is from age group 13 to 17 years of age. If they have MDD, you want to give escitalopram. If they have MDD, escitalopram. That is age 13 to 17 years. So age matters. Now, we have other ways. There are other ways to choose SSRIs. We also choose SSRI based on side effect profile. We choose SSRI based on drug-drug interactions. We choose it based on history of use. We choose it based on cost. We choose it based on all kinds of things. Now, as FDA guidelines, though, they give us a guide, at least as a starting point. Now, the guideline is good to be there, but it's not necessarily going to work for everybody. So now, let's take a look at depression, right? In the age group 13 to 17. So it is not enough to call somebody a kid. We need to be more specific, as we are now prescribers, right? We need to be specific and actually specify the age group, the specific diagnosis, not just depression, specifically MDD, So we need to be able to be, nail that and be sure of the type we're talking about so that we don't give the wrong treatment. But anyways, adolescent 13 to 17, escitalopram. Adolescent 13 to 17 with OCD, fluvoxamine. Adolescent 13 to 17 years with anxiety, specifically GAD, we're going to give duloxetine. That one is also similar to our pediatric. Now, adolescent 13 to 17 with PTSD, we give sertraline because there is a strong evidence to support that this works. Again, these are guidelines. It's not going to be a shoe that fits everyone. Now, what about geriatric? With geriatric, more than 65, you will find out this one is super easy because we have sertraline, sertraline, and sertraline. The only thing that you really have to worry about is anxiety. And geriatrics, when they are anxious, they are excited. So we're going to give escitalopram. They are excited, so we're going to give them escitalopram. It's not escitalopram, but I'm pronouncing it that way. just to help us remember that escitalopram is in fact a treatment for anxiety, specifically GAD, in our geriatric that are more than 65 years old. And there's a little bit of comment here too. Now, maternity. So people that are pregnant, if they have MDD, give them sertraline. They have OCD, give them sertraline. They have anxiety, give them sertraline. PTSD, give them sertraline. Sertraline. What else is, is that difficult? I think it's pretty easy, right? Now, what is the mnemonic to remember? This is Dr. K. Spurs, Dr. Kehinde Elisha Spurs. FESS, fluoxetine, escitalopram, sertraline, sertraline. F, pediatric fluoxetine, depression, OCD. E, adolescent escitalopram, depression. S, geriatric sertraline, depression, anxiety, OCD, PTSD. S, maternity sertraline, depression, anxiety, OCD, PTSD. So there's also a nice bonus phrase here. Don't fret, every senior stress. Don't fret, every senior stress. So fluoxetine, that is the fret. Escitalopram is every. Sertraline is seniors. Sertraline is stress. So I really hope that helped. Dr. Kehinde Elisha speaking here, founder and CEO of FNP Certification Academy. To reach us, nurse-to-nurse-coach@gmail.com or visit www.mpcertificationacademy.com to sign up for our full review for FNP, AGNP, AGACNP, NCLEX, PMHNP, AANP, and ANCC. Listen, those two exams are slightly different on how they word their questions. I have experience with both, so we look forward to seeing our review. I really hope this makes sense today. There are many more diagnoses. This is not all inclusive. Thank you so much and have a fabulous day. Bye-bye.